Welcome to 3 Minute Gestalt. This is Unit 20 on Gestalt and Psychopathology. So, like all the topics, it's a very big one. Now, what does Gestalt particularly have to say about dealing with psychopathology? In a way, traditionally Gestalt has been more focused on like a growth orientation, it's ideally suited for people who want to know who they are and live their lives more fully and experience greater aliveness. Gestalt's wonderful for that. However, most people come to a session because they've got a problem, a trauma, they're stuck somewhere, and therefore we're dealing with some level of what you could call neurosis. Less frequently, but also often, people come with deeper levels of what you could call dysfunction or greater level of problems or stresses, and these can border onto what we could call psychopathology. Now, the definition between normality and madness is somewhat a social thing, but not alone. Harry Freeman points out that people know madness. They can smell it, they can tell it. They don't have to be a diagnostician. They know that when something's out of whack, when somebody's really unbalanced. And I guess that's a way to describe what we're talking about, people who lose their balance in some form or another. There may be some degree of organic causes, there may be genetic causes, but whatever the reasons are, someone comes to us and they've got this kind of imbalance. So how do we apply Gestalt principles? Well, firstly, the phenomenological approach is very suited to working with psychopathology because we're not putting any kind of label on the person. Labels can be restrictive. Sometimes they can be useful to help someone understand a condition like ADHD. Oh, I'm not just stupid, or I'm not just irritable. In fact, I've got this condition called ADHD, and that's why. So sometimes labels have a useful explanatory value, and they can give a framework for how to work with certain issues or certain conditions. However, labels can also box people in. They can be used as kind of justifications. Well, that's my condition, so what can I do about it? They sort of fall into a kind of a sick role in a way. In Gestalt, we very much emphasize responsibility, and with whatever limitations we face or whatever conditions we may have, the question is, how can you exercise choicefulness within whatever range you have? And I think no matter how unbalanced someone is, there's always choice going on, and that's part of what we want to highlight in Gestalt and support the person with. So that's one element of the Gestalt approach. So someone's unbalanced in some way. Psychosis is one of the difficult ones, but the so-called personality disorders are also difficult to work with in therapy. But Gestalt can be very relevant in a variety of ways to these more kind of extreme conditions. The first thing I want to do is, as much as possible, I want to enlist the person in a dialogical process. If someone comes in with a diagnosis, I've got borderline personality disorder, or can you help me? Or I've got bipolar disorder. They come in with a label. I want to deconstruct that. Well, how do you know you've got that? Someone told it to you? Okay, I'll look it up with them in DSM. I'll say, well, these are criteria. Do they actually fit for you? Well, yes, they do. Okay, but then we can have a dialogue around what are these criteria and how do you experience them. So I kind of include them, if you like, in this sort of diagnostic process. And there's a lot of useful material that can come out of that and a lot of clarity about areas that they need support in. Same thing with medication. If people have been given medication, I want to involve them in considering, well, what is this medication and what does it do? And you know how it feels to you, but what are the range of side effects that have been identified, and perhaps ones that you might not even realize have to do with that. So all of these things I want to bring into a relational dialogue, making it a more horizontal process than a vertical one, telling the person, informing them, directing them, advising them, guiding them. Some of that may be relevant, but for the most part in Gestalt, we want this person-to-person, as much as possible, I bow. As I was saying, the phenomenological approach is very good because we want to some degree, enter into the reality. Now, what if the reality is imbalanced or a bit crazy? Well, of course, I'm not losing my perspective. However, I am stepping into their world and how they experience their world. And even if it's somewhat delusional, I'm not just going to do a reality check. I might say, well, I don't experience things that way, but I'm not saying it from a superior position. I'm saying, well, I don't experience things that way. Tell me how you experience them. And we step into their language, their framework. So they experience us being interested in them, not just dismissing them, not just pathologizing them, but in some ways that they can be known within that. Because for the most part, if they've got delusions, we're not going to talk them out of them. We're not going to, rationality is not going to work, and simply chastising them is not going to work so well either. And then there's the creativity of the Gestalt experiment. I'll give you one example, which I think is a very good one. A Gestalt therapist was working with a group of people with schizophrenia, which obviously is a difficult condition, and the group was variously talking or randomly reacting, or some people are silent, and the therapist had their guitar with them, and he was using his guitar to sort of play sounds that were reflecting the timbre and the pattern and the rhythm of the group. So the group got loud, and he'd play the guitar more loudly, and the group became quiet. Nobody said things, and he'd play a very gentle melody. If there was some conflict, he'd play something scratchy. So in this way, he was reflecting the group, bringing awareness back to them, and it had a remarkable effect on them. The group started to become much more kind of present and much more in sync, and much more increased their ability to kind of connect and relate. So that's one example of using the awareness principle and using creativity and a Gestalt experiment. So there's a lot of kind of possibilities with Gestalt. We do a lot with art and creative media, and that's very useful for people with some degree of mental imbalance, because they can express themselves sometimes in pictures very clearly where words don't do as well. Now, there's many different kinds of imbalances and conditions. Some people have depression, very severe depression. So in Gestalt, rather than treat the person or help them in the I-thou sense, we want to meet them, because when someone comes in with, let's say, major depression, then inevitably that's going to have an impact on the therapist. And so we want to pay attention to, well, what's the impact on me? And the likelihood is, after working for some sessions with the person, I'm going to start feeling flat. I'm going to start feeling kind of powerless and like I can't do anything here or make anything happen. So that's very useful, because firstly, it gives me an insight into what the person's experiencing. And secondly, it allows me to bring that in some way into the dialogue to really understand them, not just from the outside, but from the inside. And then hopefully organically to work within that frame with them, so that the two of us are finding our way through that. The person really feels joined by that, rather than, I'm the healthy person and they're the person who's got problems and can't get out of bed and needs help or feels collapsed. We also work with the field, and often a lot of so-called psychopathology is related to trauma, is related to incidents of sexual abuse or other types of major trauma that people experience generally in their childhoods. So that's often very important to inquire into and to do therapeutic work like we would with anyone else, except it needs to be done very delicately, because people have with unbalanced mental conditions often have less capacity to deal with stress. So we need to incorporate a great deal of support and, in a sense, less sort of phenomenological lasering and asking questions, and much more opening up the field, being present with the person, and finding whatever the way is that we can support them. And the support might not just be talking. The support might be going for a walk with them, or sitting by a lake with them, or, often in nature is kind of quite healing and supportive. So we need to expand our conception of the possibilities therapeutically of working with people with severe conditions. And we also need fundamentally to come from a sense of, I would say, playfulness and creativity, because that's often what's missing in these people's lives. Their lives, might feel empty or very stressy. And so by bringing this attitude that we do through the Gestalt experiment of let's play with this, often we can engage the person. The last thing I'll say is bodies are very important. And often people with various types of mental imbalances, there's a lot going on in the body that's reflected in their body. And sometimes, because words are more difficult, working with the body aspect of their experience can be very helpful. often it's difficult for them to identify their experience, and so sometimes with appropriate boundaries and clarity, we need to use touch. Sometimes that can be traumatizing for people. Of course, there needs to be consent and sensitivity in how we do it. But touch can be very good because it can reach through to people and help them feel connected and grounded and work with whatever chronic contractions they've got. And that's a very, I think, appropriate and important element of working with various degrees of mental imbalance, not just working cognitively. So these are some of the elements of the Gestalt approach. There's a lot more, but this is a nutshell, so I'll wrap it up here.